Hi, welcome back. Today, let's talk about occupational lung disease. It's a condition that develops when someone breathes in harmful dust, chemicals, or fumes at work over a period of time. It doesn't always come suddenly. It often builds up slowly, sometimes over years, although some types can develop more quickly or even acutely, depending on the exposure and the specific substance involved. It usually starts without much attention. A person may feel fine at first, even while being exposed daily. But as time goes on, the lungs start getting irritated, inflamed, or otherwise affected depending on the type of disease. Small particles or harmful substances can go deep into the lungs and, depending on the condition, may cause ongoing inflammation, immune reactions, toxic injury, or gradual damage such as scarring. Because of that, symptoms often show up later. The most common sign is a cough that doesn't go away. Some people notice they get out of breath more easily, even with simple activities like walking or climbing stairs. As it gets worse, breathing can feel tight or difficult even when resting. Tiredness is also common, especially in more advanced disease, because breathing may require increased effort, physical disconditioning, systemic inflammation, or in some cases, reduced oxygen levels in the blood. This can happen in different jobs depending on what someone is exposed to. That's from mines or construction sites, chemicals in factories, smokes, or even fine particles in the air can all play a role. Over time, some exposures can cause scarring or other types of damage in the lungs, while others mainly cause airway irritation or inflammation, and some can trigger immune-mediated reactions, which makes breathing harder. People working in mining, construction, farming, shipyards, and certain factories are more at risk, especially if safety protection like masks is not used properly. Smoking makes the damage worse and increases the risk of several occupational lung diseases. The important thing with the condition is prevention. Once significant irreversible lung damage, especially fibrosis, occurs, it is often not possible to fully reverse it. However, some types of occupational lung disease like occupational asthma or certain inflammatory conditions can improve significantly or even resolve if exposure is stopped early. Avoiding exposure using protective equipment and following safety rules at work are the key steps. Treatment usually focuses on making breathing easier and stopping it from getting worse. That can include inhalers, mainly in airway diseases like occupational asthma, oxygen in more serious cases, pulmonary rehabilitation, anti-inflammatory treatment in selected conditions, and sometimes changing the work environment completely or removing exposure entirely. In severe cases, lung transplantation may be considered. It's one of those conditions that develops quietly, but over time it can seriously affect how well a person can breathe and live their daily life.